Hello friends. Today we are going to discuss about World Health Day 2024. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about World Health Day 2024. Every year, we celebrate World Health Day on 7th of April. This day is celebrated by World Health Organization across the world to draw attention to specific health topic of concern to the people all over the world. World Health Day was established in 1948. Immediately after the Second World War, the United Nations was formed, and later the World Health Organization was formed. In this regard, 7th April was considered to celebrate the World Health Day and also to bring the important health concerns to the international forum so that we can discuss and eradicate. For example, smallpox is one of them. The nearest was COVID 19, although the COVID 19 pandemic, which took many people's life across the world, but the scientific sharing, discussion, and also evidence based how to manage and with regard to genome of the COVID virus was released to all the countries. Available treatment was discussed, and it was the first time in a single go the World Health Organization was able to play a crucial role in dissemination of information available on day-to-day basis. Hence, 7th April is very crucial in this regard. Hence, World Health Day is considered is a founding day where international community come together to discuss the world's important health issues. As you know, in the contemporary world, the conflicts, wars, disaster, terrorism, and environmental impact are devastating lives, causing death, pain, hunger, and psychological distress across the globe. As you know, the Ukraine and Russia conflict, invariably Israel and Hamas conflict, various other conflicts in African countries has raised important concern with regard to health of the human beings. It is from the child to the geriatric age, everyone is suffering. In this regard, the health of the individuals who are on the either end of the spectrum, that is children and elderly, are susceptible to the war and conflict. Hence, to address this challenge, in this year 2024, the World Health Organization has decided to come up with a theme, My Health and My Right. This is an important theme, my dear friends. That is, my health, my right. That is, every citizen has a right to a good health. Hence, this theme during 2024, WHO estimates the burning of fossil fuels, war, conflict, and terrorism are driving the health crisis and taking away our right to breathe clean air, access to nutritious food, clean and drinking water, access to health care, safe home, and peace is robbed because of this. In this, indirectly, the health of the each individual is affected. Invariably, the people who are children, pregnant women, elderly population, people from backward communities are affected. That means their health is at risk. In this regard, the WHO Council on the Economics of Health for All has found that although at least 140 countries recognize health as a human right in their constitution, but only 4 countries have mentioned how to finance for this health as a right. In this regard, my health, my right. At the heart of this theme, it recognizes that health is not just the absence of disease, but a state of complete physical, mental, and social well being. Here, the important word social well being. That means the right to health is more than the access to medical facilities and medicine. Here, right to health achieves a bigger vision. It is essential to address various social determinants of health, such as respect and dignity, free from discrimination when receiving healthcare services, gender equality, adequate sanitation and housing, nutritious food, health education, healthy working condition, clean environment, safe district, freedom from harm and access to justice, being able to make decision about one's own health, war-free zone, conflict-free places, terrorism-free zones, environment free from pollution. All these play a crucial role. If there is war, terrorism, and conflict, the impact has a direct on the health, that is death or else physical injuries, disabilities. Many a time, the bystanders develop post traumatic stress disorder, depression, grief, anxiety disorder, that is, mental trauma or disability. Access to healthcare becomes difficult. All physical infrastructure with regard to health becomes dismantled. Many a time, even the healthcare personnel are killed during this war. Displacement, refugees of this huge number of population, which directly affects the children and elderly. Malnutrition, not not available enough of adequate safe drinking water, disease outbreak, gender based violation, and this violence leads to various other mental health issues. Disruption of health system is biggest challenge during the war, my dear friends. In this regard, the Constitution of India is very clear. Although the Constitution, when it was drafted, it did not directly speak about health as a fundamental right. However, the Supreme Court, in its various judgment, has brought under the Article 21 right to life and liberty. In this, the Supreme Court has clearly said that the fundamental right to life and liberty also extends the inherent life with a right to health and with the dignity. Further, directive principles of state policy makes the state with regard to Article 38, 39, 42, 43, and 47 obligates the state to ensure the practical realization of the right to health. So now the question is, what is my role? What can I do? What you can do to make sure right to health is there for everyone? Here, on this important day, everyone should become aware that the conflict, terrorism, and war are the more significant health threat facing the humanity. Directly, the children, pregnant women, and elderly are at the receiving end of this war. Hence, the health professionals, it may be doctor, nurses, physiotherapist, every healthcare professional need to raise their voice and raise their voice against war, conflict, and terrorism. That means we are not here just to heal the soldiers or injured. We need to prevent these wars and conflict. Hence, all the healthcare professionals need to stand unitedly and say no to war. Many governments have met the threat of COVID-19 pandemic with unprecedented funding and on emergency healthcare provisions. Hence, this war, conflict, and terrorism crisis demands a similar emergency response which was given during pandemic COVID-19, my dear friends. That means, again, although the COVID-19 was induced by virus, the war, conflict, and terrorism is done by our own human beings in the name of religion, in the name of politics, geography, and various reasons. And innocent people, children, elderly are killed. This is unwanted, unwarranted, and huge number of population suffer from various health problems. So, under the public health system, the primary line of defense is the doctors, nurses, and healthcare professionals. And these healthcare problems which arises because of this crisis like terrorism, war, and conflicts needs to be stopped at the earliest. And we need to urge all the world leaders, WHO, and United Nations to stop this war and conflict. Although this theme appears to be appealing, but however, it also has its own criticism. Here we talk about my health and my right. This completely undermines the individual responsibilities and duties. Here you talk about only the rights. What are the duties and responsibilities of each individual? Unless the individual starts thinking and taking action, such as doing exercise, eating right, and doing meditation, that means there will be no right. That means every right comes with responsibilities. If you want my right and my health, you have a responsibility to raise voice against war and conflict. Every citizen of the globe needs to stand together and say, for my right and my health, it is my duty to make sure there is no war, no conflict, and no terrorism. Hence, we need to increase access to healthy food, stop war, stop terrorism, and also conflict, increase physical activity, should limit marketing and marketing the junk food, and also we need to increase the taxes with regard to unhealthy food and drinks. We need to cut the consumption of processed food, and we need to build the state of the art public health system across the globe. And we need to avoid the widening of health inequalities between the poor and the richer. All countries, all fellow human beings, every citizen must raise voice against terrorism, war, and conflict. That means we have a huge role to play with regard to this theme, my dear friends. Hence, the countries who have disproportionately made money by selling arms and ammunitions must do more to bring peace and tranquility across the world. They should not be selfish by giving guns to the poor people and asking them to fight. It is not far that these ammunitions will fire within your own homes. That should not happen. Hence, all the developing countries, and every human being has to stand united and say, my right, my health, and my duty to stop the war, the conflict, and also the terrorism. The majority of the countries identify health as a priority sector, but there is a considerable finance gap remains. That means the amount or the percentage of GDP invested in health versus defense. If you compare in every country, you will realize that the importance for health is very less, whereas for the defense is huge. If all the countries come together and if the peace prevails, the same amount of money can be invested in health, education, and justice. Hence, there is a immediate need of attention with regard to the current theme, my health, my right, but my duty to raise voice against the war, conflict, and terrorism. Thank you, one and all.